Well, the first time I walked into the main entrance, I thought of Seattle Grace, and I thought, wow, this is so cool. Like, that's a hospital that's in a TV show. And the space and the light and the brightness, it's phenomenal. It's really hard to express in words.
And I was surprised to see how it's really very nice, modern, brand new building. Patients can access pretty much any service they need here, and it's a big asset to the community. Yeah, so working in a smaller community like Truro, rather than most of my training down in the city, I find that I get a lot more opportunity to work one-on-one with the doctors that I'm working with and the staff, and that really allows for a lot more of a stronger mentorship bond to be created. And I find I'm able to really get good quality feedback.
So I think having a lot of the upgraded equipment, a lot of the modern equipment nowadays gives us a lot of opportunity to serve our communities better. Instead of having patients that we have to send to different sites to have certain tests and scans done, we can just keep them here, keep them in their home community if possible, and just get everything they need to be done here just for the best possible patient care.
My name is Nina McCarr. I'm a family physician, and I am proud to say that I have been practicing in Truro since 1997. We, as a medical staff, are a very close-knit community. A couple of times a year, we do have social networking that we organize ourselves outside of the hospital, sometimes in the hospital, but it can be something like going to a barbecue at one of the physicians' houses, or at Christmas time, we always get together and have a medical staff party. So the social networking and, recognizing that that is an important factor.
I'm Caitlin. I'm currently in my 4th year of medical school at Dalhousie. I found it to be a really supportive learning environment. I find people are very interested in providing whichever learning opportunities I'm interested in. And so anytime I've expressed an interest in a certain area of medicine, I find people have gone out of their way to provide those learning opportunities for me.
My name's Katie Henniger. I've worked at the Colchester East Hants Health Centre for about 4.5 years. I started here as a technologist in X-ray and CT in 2021. I just started in a new role as the manager of diagnostic imaging and cardiac investigations here at Colchester and Lillian Fraser just over a month ago. So as a student coming into our department, I think we would be seen as a pretty welcoming environment. We have a lot of techs who are willing to train, be preceptors for new techs or students. We're happy to help because we really are happy to have more techs in our department to build that sense of community and family.
It's a really good idea to just come give Truro a chance. I think medical education is pretty unique in that we get the opportunity to see so many different areas. We're moving to a different location every 2 or 3 weeks. And so that can be challenging in itself, but I think rather than later in our careers, now we have the opportunity to get around and see every different hospital and see what the relationships are like between physicians and what it would actually be like to practice here. And so I would encourage other students to come see if this is a place they'd like to practice.
If you're looking for a place where you can find the perfect balance between work, life, and family and community, I think you will not be disappointed with what Truro has to offer you.